Like they said, stroke at 32 and pregnant, it was really something else. I was 36 weeks pregnant with my 5th child. This pregnancy was typical up until that fateful day on August 31st, 2017. It was a Thursday, and while at work, I started to notice some numbness and weakness to my right arm. I thought it was just because I was tired, so my husband took me home to rest. I started having trouble speaking. My symptoms were worsening to the point I couldn't speak, nor could I understand the words people were saying. The right side of my face was also drooping. So my husband called 911 and I was taken to Guam Memorial Hospital. The doctors there were greatly concerned that I was having a stroke. After a CT scan confirmed I was suffering from a major stroke, I was transferred immediately to GRMC.
The type of stroke Madonna had was a common one.
An ischemic stroke due to a blood clot in the brain.
However, the patient was far from typical because one, Madonna's age, and number two, the fact that she was 36 weeks pregnant.
Typically we would give thrombolytics if the symptoms had started less than 4 hours ago and if there were no contraindications to giving them. In other words, we would give the clot-busting medication to try and break up the clot if there was a low chance of their causing serious bleeding.
Pregnancy is a relative contraindication to getting thrombolytic therapy. Because of this and the fact that she was outside the time window, a reason she couldn't get this medicine.
By the time she was in the cath lab, it was already 6 hours since her symptoms started. The only option left for Madonna was an endovascular mechanical thrombectomy, which I performed emergently with the assistance of our highly trained cath lab staff and using specialized equipment. This includes fluoroscopy, which is a means to use real-time X-ray, allowing me to operate in the brain without having to cut into the skull.
We were, of course, greatly concerned given there were 2 lives at stake here. The OB team stood on standby in case she needed an emergency C-section, but luckily we did not have to. But if we did, the cath lab is already a fully functioning operating room, so we were fully prepared.
So Dr. Shea was able to successfully remove the clot, which was in a major artery in my brain almost immediately. My symptoms started to resolve. I started to be able to speak and move my right side.
After her procedure, she was transferred here to the ICU for closer monitoring. By the time she was in the ICU, she was able to speak clearly, understand words people were saying, and regain full use of her right arm and leg. Baby was also appearing to be healthy and unharmed. Over the next several days, we performed a battery of tests to determine if she might be at high risk of having another stroke that could follow immediately. We did not find any. Her entire care team also included obstetricians, internists, intensivists, neurologists, cardiologists, hematologists, anesthesiologists, neonatologists, and radiologists. Our consensus was to continue to monitor her as an inpatient and allow baby to get to at least 37 weeks gestation, which she did.
I delivered a baby girl named Safira Sky, September 9, 2017, without any complications. She is completely healthy and she is nothing short of a miracle. I am also doing just fine. I did experience a stroke. And having that I was pregnant during the time, it was really something unbelievable.
Thank you so much for sharing your amazing story. I understand you're back to work.
Yes, I am.
Can you share with us where it is that you work?
Actually, for the past 2 years, I've worked right here at GRMC at our billing department.
Wow, I'm sure you look at your job completely different now.
I do, but not only because I had the opportunity to overcome what was potentially a fatal event for me and my baby that at the very least could have left me permanently disabled, but mainly because I am proud to work with such amazing people. We are truly blessed to have these services right here on Guam.
Nothing short of a miracle.
Yes, nothing short of a miracle.